So we treated for, to get rid of the inhibitor, we, elected to remove factor VIII from his system for over 6 to 7 years. And then we started immune tolerance induction, which lasted a year and a half, and we were unable to tolerize. So we just now treat prophylactically and on demand with FIBA and Nova 7. So a positive would be having the access to determine whether or not you can treat with either bypassing agent. At one point our HTC wanted to take one of them away from us. And I said, wait a minute, we may have a bleed that responds better to one therapy versus the other therapy. So to be able to have both of those therapies in our tool belt gives us more availability to treat his needs and his bleeds. A setback for, Nova 7, which is the bypassing agent we would use, is that the lifespan of it is only 2 hours. And regardless of how much you stack it up, if you, combine and give him 2 doses of Nova 7 to get him to what your physician would consider 100%, he's still only getting coverage for 2 hours, not an extended 6 hours. You can't extend it when its life is only 2 hours. So we're giving him more, but it's only lasting 2 hours. So if he did have bleeds, we would be infusing every 2 hours. It put time constraints on, social activities. It put time constraints on getting him to school, getting to work, practically having a life outside of our infusion schedule. When we introduced FIBA into our prophylactic schedule, we got a little bit more time. So the pro would be that the half-life was longer. The cons of using FIBA to treat is that you have to wait time before you can try your other bypassing agent to see if that's going to work better. The volume to be infused is more. So as he gets older and he grows more and his weight gain is more, then we're infusing of a larger volume, which takes more time to infuse. Where Nova 7 can be pushed, the recommendation for FIBA is that it is infused over a period of time. And so we've tried to maintain that strict protocol of keeping it an infusion, which means getting up an hour earlier in the morning. We had to get a portacath because we were infusing such large volumes, and we don't want to ruin all his veins at such a young period when he may need those in the future. He will need those. So thinking of accessing supplies, we have to have a whole separate refrigerator in our house to store factor because we go through a lot of factor. An inhibitor patient goes through so much factor that you need a separate refrigerator. I was at one point making the decision on how much food to buy because I only had so much room in the fridge, So having that extra refrigerator that was just for medication was crucial. You have to think about in terms of, am I going to be home to get that shipment of factor because it's a tier 3 drug. So there's logistics in place. You have to make sure you're calling and ordering factor and supplies so you never run out because it's crucial. Your HTC probably has factor on hand, but in our situation, we live so far away, our local hospital does not have it. We would not have access to the medication we need to save his life if it came to that point. We have to carry a medication bag filled with supplies not just for peripheral access, but supplies to access a portacath. We have to carry supplies for both FIBA and Nova 7. So my child knows that he can't go anywhere without his medication bag. And that's kind of like his best friend. It's become a part of him. So there's been a lot of constraints with the different treatments. There's been a lot of pros and there's been a lot of cons. The biggest pro is that we have something to treat him with. And it's just in knowing the knowledge of which one is going to be better treatment for him and which one isn't.